Well, viewers, our next broadcast is from Doctors of the World. Stay tuned and let's see what they have for us.
Welcome, viewers, today at GAM TV. I'm Carola Lering from Doctors of the World. Today I'm interviewing my colleague, Dr. Jason, who is also working for Doctors of the World as a volunteer these days. Please, can you introduce yourself?
Yes, of course. So I'm Jason. I'm in my day-to-day life, I'm a medical student. So I'm not a doctor yet, but I will be soon. And I volunteered during this corona crisis to educate people about the virus itself and also about the measures that the government took to make sure that everyone knows what to do and also knows why they have to do it. And that is also what I'm doing today. That is why we're doing this interview.
Thank you, Jason. Before we go into the subject of the coronavirus and questions related to the coronavirus, I would like to introduce a little bit the projects Doctors of the World in the Netherlands is doing. So I will first inform you about that and then we go towards the interview. Well, as I said, I would like to give you some information about Doctors of the World. First of all, we would like to thank GAM TV very much for inviting us to do this interview. We think it's very important that also the migrant communities are well informed about the coronavirus and also the regulations the government made which are connected to this corona crisis. But first of all, Doctors of the World is an international organization with its head office in Paris and 14 departments in other countries like Germany, England, France, Greece, Spain and the United States. We have our international projects, but also we have our national projects. And I would like to inform you that Doctors of the World Department in the Netherlands has two projects which we carry out in the Netherlands. These two projects are focused on undocumented migrants, that are migrants who have no Dutch papers, and the second project is focused on asylum seekers and refugees which do have Dutch papers. What is very important to say is that these two groups are very vulnerable groups and they have problems in accessing the healthcare system in the Netherlands. For many Dutch people, it's already a problem to understand and to access the healthcare system in the Netherlands. So it's extremely difficult for people who come from abroad. A thing which is very important to know is, although undocumented migrants have no Dutch papers, they still have the right to healthcare when they get ill. This is very important information because if you are a migrant and you have no Dutch papers, formally you cannot insure yourself. You cannot arrange a healthcare insurance unless, not get a health insurance. But luckily you still have the right to medical care when you get ill. So that's very important to say. At the end of the program, I will give you some extra information, some phone numbers which you can phone for consultations with a medical professional, and also the information that you can visit our medical van. But this is for now the introduction before I go over to the interview with Dr. Jason.
Well, viewers, that was a short introduction from Doctors of the World. Now we are going to go more into the coronavirus. They have a lot of clarifications around questions that we have in the community about this virus. Stay tuned.
Welcome in the studio. Very kind of you that you want to do the interview for us. Like I said before, we are going to have it about the coronavirus. And maybe you can introduce yourself a bit, because you are already working for Doctors in the World as a volunteer. What actually are you doing these days?
So in my normal life, I am a medical student, so I'm not a doctor yet, but almost. And I volunteered because of the corona crisis for Doctors of the World. And together with a colleague of mine, I especially specified education about coronavirus and about the measures that the government took to educate immigrants about the virus and what they can and can't do anymore because of this.
Yes, okay, wonderful. So can you tell us a bit about what is the coronavirus actually, and what is COVID-19? Where did it come from, and what makes it different from a normal flu, for example?
So the coronavirus, or actually the new coronavirus, belongs to a larger group of coronaviruses. SARS and MERS are examples of other coronavirus that happened in the past. And the new coronavirus is a new form of it, so we don't know it yet. And this can cause the new disease, COVID-19, that stands for coronavirus disease in 2019. And it can cause lung and airway problems. And in 2019, in December, the first person who had coronavirus was identified in Wuhan, in China. And the exact behavior of the virus is not yet known, also not exactly where it came from, but usually these viruses are carried by wild animals. And if people come in close contact with wild animals, the virus can spread to the human. Sometimes the virus can also be spread from humans to humans, which can cause an outbreak. And this is exactly what happened with the coronavirus now. So it called the WHO, so the World Health Organization, they called for a pandemic in March, last March, because there was an outbreak worldwide. And a lot of countries were affected. And what makes it different from the influenza are two things. So sometimes, of course, you can have the same symptoms, especially the mild symptoms that I will talk about a little bit later, can be the same for the flu as for the coronavirus. But two things are different. The first one is that the coronavirus is more contagious than the flu, which means that one person can infect more people than with the coronavirus than with the flu. And the other thing is that the coronavirus can also cause more severe symptoms, which can cause bad conditions, way worse conditions than with the flu, which also makes this virus very dangerous. But a lot of research is still being done about the virus, so a lot of these answers are also going to be more clear in a while when all the research is done.
Yeah. So the coronavirus really exists?
Yes, it does. Yeah, this is something that I hear more often, and also my colleagues do. That's something that worries me, because that might mean that people don't stick to the rules that the government apply because they don't believe in them. But the fact is that worldwide over 5 million people, are infected by the virus, and more than 300,000 people have already died. The same goes for the Netherlands, so also here a lot of people died, a lot of people are infected. So it's really important to, even if you don't believe in this, please stick to the information that you hear from the government and from institutions like the WHO or the RIVM. And stick to the rules, because they are very important to stop the spreading of this virus.
Yeah. So how can we actually prevent getting sick from the coronavirus? And what does the government arrange for that?
Yeah, so there are a couple of rules that the government set to prevent the virus. First of all, you can be infected by the virus through your eyes, your nose, and your mouth. So those rules are kind of based on those three entry points. So first you can, when someone sneezes within 1.5 meters from you, and that person is infected with the coronavirus, then particles, so drops with the virus in it, can go into the air, and they can go into your eyes, your nose, or your mouth, and that is how you can get infected. That's also why the government said that you have to stay 1.5 meters apart to make that chance of getting infected by those droplets in the air very low. Also, you need to avoid crowded places, and you need to stay at home and work at home as much as possible. And then second of all, you can also get infected, for example, if someone who has the coronavirus sneezes in their hand, they touch a surface, and then you also touch that surface, and after that you touch your face. Then you can also get indirectly infected by your hand, by the virus on your hand, which is why it is really important to always wash your hands, to clean surfaces, and the government also advises you to cough and sneeze in your elbow or in a paper tissue, and if you did that, then you need to throw the tissue out immediately after that.
Yes, and well, they say you have to wash your hands with soap and running water for 20 seconds. That long is really needed?
Yeah, that's actually really needed. So there are two ways to clean your hands. First is with water and soap, as we all know it. The soap actually needs 20 seconds at least to kill the virus on your hands. So if you wash your hands for less than 20 seconds, then not all of the virus particles are killed on your hand, which means that you can still infect yourself by touching your face. And also you need to use alcohol. You can use alcohol sometimes instead of the soap, and that alcohol has to be at least 70%, so it needs to be a solution with at least 70% alcohol, because only that amount of alcohol can kill all the virus on your hands.
Okay. And what about the hand sensitizer? I don't know if it's always with alcohol, but is that more effective or is soap more effective?
They're both equally effective. In some situations you can choose one over the other. For example, if you have visible dirt on your hand, you need to wash your hands with water and soap, because that will also rinse all the dirt off of your hands. But for example, by using a lot of soap, your hands can get really dry if you have sensitive skin. Which also breaks the barrier on your skin, which can cause more bacteria to go into your skin. So in that case, it is recommended to use the hand sanitizer that usually always contains alcohol, and usually contains also an emollient base, so a fatty base. And if you use that on your hands, then you also make your hands more fat, which makes it less likely to crack and to get dry.
Yeah, okay. But it's very important to do it regularly, not just once in the morning and once in the evening. In between, during the day, you need to wash also your hands.
Yes, definitely. Yeah, you need to do this more regularly than you did usually. And in theory, every time you touch the surface that might be contained with the virus, you have to wash your hands again.
Yeah.
Or don't touch your face.
Yeah. Okay, that's clear. Yeah. So, listeners, viewers, you hear from the doctor, it's very important not just to wash your hands 1 or twice a day, now during the day also. And it's very important to keep secure for yourself and others. Now we're going to talk a bit about the masks. You see more and more people wearing masks on the streets. The government has decided from 1 June on that the trains and the trams and the buses will circulate more often, and that the people who are using these public services need to wear a mask. So my first question is, do surgical masks, mouth masks, offer good protection against the coronavirus? And is it needed to wear those? Or is it needed, or is it obligated to use other mouth masks? How is that arranged?
So, do the surgical masks protect against the virus? First of all, the short answer is no. There's research, only limited research about this topic for the coronavirus specifically. And it's also controversial, so some research says that it helps, some research says that it doesn't. One very important thing is that you need to focus on the proper use of the mouth masks, because it can also be more dangerous if you don't use it properly. I will talk a little bit more about the proper use of it later. From the 1st of June, the government indeed said that you have to wear this in public transport. They actually recommend you not to wear the surgical masks or the other medical masks because they are scarce. We don't have enough in the Netherlands. And so it's better if the healthcare workers can use those. And then for us, we can buy masks, for example, the single-use masks that are not medical, or we can make masks ourselves. It's really important to note that it's primarily to prevent you from spreading the particles into the air, so from infecting other people. It will not protect you against the virus yourself. So that is one really important point that you need to keep in mind. That is also why it's only an add-on to the general rules that we have, not a replacement for the rules. You still have to stick to the distance, you need to cough and sneeze in your elbow, all of the things that we talked about earlier, you still need to do. So you can buy the single-use masks, for example. The way that you use those is before you put them on, you have to wash your hands, like we talked about just now. Then you put them on your face, you make sure that you close it by your nose and also around your mouth, that it's completely covered. Then you don't touch it anymore. I see a lot of people taking it off and then putting it under the chin.
Yes,
yeah,
that's true.
Yeah, that's not, you don't, really, please don't do that, because then you actually touch the mask again and there's virus on the outside of the mask, which makes your hands dirty again, and then the virus can spread anyway. So please don't do that. Once you put it on, don't touch it anymore. If you don't need it anymore, then you have to take it off. The single-use mask you have to throw away, and then you wash your hands again, or you use the alcohol on your hands again. And then some people can also buy or make masks themselves. You can make them from t-shirts or from kitchen towels, for example. Some people use Hoover bags to make the masks. And a lot of those material you can wash on 60 degrees, and that makes the virus, also kills the virus. So once you use them, use it the same way as I talked about the single-use masks. But when you take it off, you wash it, and then you can wear it again.
Yes, and I understood also that, for example, if you're going on transport, you're going to Leiden, for example, you take two clean masks. So for the way to go, you use a mask and then another new mask or fresh mask you use for to come back.
Yeah, exactly.
So it's not that you're going to wear the same mask when you go back.
No, when you take it off, in the meantime, you have to wear a new one.
Yes.
Or a clean one.
Yeah. And if you those washable masks, if you wash them in 40 degrees, it's not enough.
No, you have to wash it on 60 degrees, only then it kills the virus. Yeah.
Okay, thank you. Well, I think many people are interested in making their own masks. I mean, the African tissues or the African cloths are so beautiful, so you can make beautiful masks of it, but you should make several, because if you go on a trip, you use the one to go and then you use another to come back. What are the chances that I will catch the virus through my eyes? This is a question which has been asked by several migrants, so I would like you to go into that, please.
Okay, sure. So there's no research yet about the coronavirus related to which part of your which entry point, so the eyes, the nose, or the mouth, is the most likely to make you to get you infected. So all three of them need to be considered as equal entry points for now, which means that your eyes are definitely a large part of how you can get infected. Also, if you use the nose and the mouth mask, of course you can still get infected through your eyes, but also through the holes in the mask. So what I really wanted to say about this is that the masks are protecting the virus from spreading. So if everyone wears it, then there are less particles in the air, which makes it less likely to still be in the air. And if there are less particles in the air, then it's also less likely to get into your eyes. But still, if you touch a surface and you touch your eyes, you can still get infected by your eyes. So if everyone in a small space like public transport wears the mask, then the chances of virus particles being in the air are smaller, which also makes the chance of getting infected through your eyes smaller. But still, it doesn't protect 100%, definitely not. So you still have to keep the 1.5 meters distance and all the other measures that we talked about. That's really important.
Yes. Yeah. Okay, thanks. And then there are two terminologies which are used, the terminology physical distancing and social distancing. Well, this gives some confusion among our viewers. Can you explain what's the difference, or do they mean actually the same?
Yeah, they actually mean the same, or at least I understand the confusion because those are very different terms and you can interpret them in different ways. But practically they mean the same because they refer to the fact that you have to keep 1.5 meters distance from each other. You preferably would use the physical distancing because it reflects the 1.5 meters physical distance better. Social distancing can also be interpreted as the fact that you can't come in contact with your friends or your family anymore, so really be socially isolated. That is not the point of this measure at all, especially in these times where there's a lot of stress and worries. It is important to keep in contact and to sometimes see your friends or family, whether that is online through video calling or texting or in real life. You can, for example, go for a walk with your friend, but then you need to keep in mind that you have to stay 1.5 meters apart, so the physical distancing, and to not go to crowded places where there are a lot of people who had this idea. And also don't go with a lot of friends or a lot of family, just go with one or two and stay out of areas where it's crowded. So definitely not social distancing, physical distancing is the preferred term.
Yes. I have understood that if you are in a family living in the same household and you go for a walk, then you can be four, for example. If you are a couple, you have 2 children, you can have a walk and you don't have to keep the 1.5 meter distance. Mm-hmm. And what I understood, but if you go out with a friend with who you are not living in the same household, then you should be with 2. If you by coincidence meet a third person on the street, you can greet each other. But I have understood also that to go out with 3 persons who are not living in the same household, I have understood actually that also is not the intention.
Mm-hmm. Yeah, exactly.
Yes, okay. Thank you. Okay, now talking about COVID-19, there are various symptoms connected to this illness. You have mild symptoms and you have more severe symptoms. Could you explain something about it to us, please?
Yeah, definitely. So you have the mild symptoms and the severe symptoms, like you said. Those are the 2 categories that also say something about the things that you have to do, because there are different things that the government says you need to do within those categories. So first of all, the mild symptoms can be the same as if you have the common cold or the flu, which can be sneezing, a little bit of coughing, having a sore throat, you can have some headaches, you can also have infected eyes, for example. Some people with the coronavirus also mention that they have a loss of taste or smell. And sometimes you can also have some gut problems like diarrhea. So those are all mild symptoms. You feel a little bit tired. And then sometimes that can go into severe symptoms, which means that you can have a body temperature above 38 degrees, so you have a fever. You can have you can be short of breath, so have a lot of trouble with breathing. Sometimes you can cough a lot and you feel very tired, very fatigued in your whole body. And so you really don't feel well at all. Those are the severe symptoms.
Yes. And sometimes it can be like this. In the beginning you have the mild symptoms and you maybe think you just have a flu, but you have to be cautious, you have to reflect a lot on yourself if it is becoming more severe. That's very important.
Yes, definitely.
Yes, and that can last for 3 days, something like that. If your temperature is getting higher, you're coughing more, you're short of breath after 2 or 3 days, then it can be really possible that you're getting severe symptoms.
Yeah, that is definitely possible. But the fact is that we don't know that. We don't know what is going to happen and if your mild symptoms will go into severe symptoms. So regardless of whether you know this or not, you need to stick to the rules and apply those rules. Also, if you think that you just have the common flu or the common cold, you don't know that for sure. There's no way of knowing unless you are being tested. So make sure to treat it as if you have corona and as if be as cautious as possible.
Yes.
Thank you.
Okay.
Yeah.
So if you get these complaints, what should you do then? Should you call the doctor also? Well, what are the rules? And next to the rules, when should you call the doctor?
Yeah, so that's again dependent on the severity of the symptoms. So if you have mild symptoms like sneezing and a little bit of coughing, the things that I just mentioned, you need to stay at home for at least until you are symptom-free for 24 hours, which means no coughing, no sneezing. You feel absolutely fine, no trouble at all for 24 hours, and then you can go outside again. Until that time, you stay at home, and it's called home isolation. And then sometimes that can go into more severe symptoms, like you said, after a couple of days, 3 to 5 days, that can happen. So that means that, for example, you are shorter of breath and you have a fever. And in that case, you and also all the people that you live with, so family or roommates of yours, you have to stay at home. They have to stay at home as well. And now the government, of course, understands that people need to eat, so you need to get food. Which is why they allow one person, so one roommate, who does not have symptoms, to go outside to do groceries. And that is the only thing they can do. They can only go outside, get groceries, and come back again. And then they also have to stay inside.
Yes.
If you want to know the difference and you want to know whether you have mild or severe symptoms, you can use this as a general guideline to think, can I overcome this disease by just resting? So sleeping, for example, a little bit, and then you feel a little bit better again, then you probably have mild symptoms. If that is not the case, so you feel really bad and you cannot just rest and then it will go over, then you probably have severe symptoms, which means that you need to consult a doctor. And then the doctor will estimate whether you have to go to the hospital or not.
Okay. But before you consult the doctor, so during the period that you have mild symptoms, can you use some medication just to that you can bear it better? Is it paracetamol or ibuprofen or I don't know?
Yeah, definitely. If you are in pain and if you have a temperature that is higher than usually, you can definitely use paracetamol, for example, and also ibuprofen. Those kind of medications, you can use them. There was some research, or there were some rumors that you cannot use ibuprofen and those kind of medication. That is actually not true based on research now. So you can also use that.
Okay. And can I be tested for the coronavirus even if I have no complaints, but just to be sure for myself and to feel safe?
I understand that people want this, but it is not possible at the moment. There are not enough tests. Now only people that work in health professions or that work in contact professions like barbers, they can get tested only if they have symptoms. And the government is going to try to make this possible for everyone. So in June, they're going to try to make it possible for everyone who has symptoms, COVID-19 symptoms, to get tested.
Okay, but then it doesn't mean only severe symptoms, but also mild
Also mild symptoms. Yes. Yeah.
Okay,
Yeah.
okay. Well, that's already a big step, I think.
Yeah,
Huh?
definitely.
Yes, yes. Well, we have discussed already the issue of when you are positive tested. Oh no, we didn't discuss it yet. If I'm tested positive for corona, and that means that I have the virus, what do I have to do?
Mm-hmm. Yeah, so if you have the virus, so that is, by the way, a small note. So if people say you are positive for the virus, that sounds like something that is good, but positive actually means that you have the virus.
Yes.
So that's important to note. And then, so if you have mild symptoms, you have to stay at home until you are symptom-free for 24 hours, like I just said. So no coughing, no sneezing, nothing. You feel absolutely good, and then you can go out if you have been experiencing that for at least 24 hours. And again, if it doesn't go away by itself, but you develop more severe symptoms, then you need to consult a doctor. And say probably if you are tested positive, the GGD or your family doctor already knows that you are positive, so you can stay in contact with them.
Yes. And do you need to go always to the hospital, or it depends of your symptoms?
It's dependent on the symptoms. Yeah, if you have mild symptoms, you definitely do not have to go to the hospital. If you have severe symptoms, sometimes you have to do. Sometimes you can also do it still stay in contact with your doctor at home. But if your body cannot fight the virus itself and you need some extra support, medical support, then you can go to the hospital.
Yes. Should I visit the hospital just by myself, or do I need to take always contact with my huisarts, with my family doctor?
Yeah, the last part is what you should do. So you should always first call the doctor, so not the doctor in the hospital, but the family doctor, and then discuss with them what you need to do.
Okay.
Do not go to the hospital yourself.
No.
Yeah.
Okay. Actually, about the hospital, I also have a question, because now for me now it's already clear that you first have to go to your family doctor, because I know that many migrants, the health system in the country where they come from, they just go directly to the hospital. But in Holland we have a different system. We have the general practitioner. It's called in Dutch huisarts. In English you can call it also family doctor. They are your first contact point. So please always call them. And from 1st of June, the family doctors are more accessible again. Some will even receive you at the practice. But it's also possible they want to call you through FaceTime or through video chat. But anyway, they are more accessible, so that's also something positive to say. A lot of people are also afraid to go to the hospital. Can you tell me a little bit about, is the hospital dangerous now with this flu? Is it well protected there if you have to come there? Can you explain me a bit about it?
Yeah, of course. So first of all, the hospital is not a dangerous place. Some people think that it is. It is not. People there are there to help you. Whether you have coronavirus or are infected by it or not. So it is not a dangerous place. If you have any complaints and there is a need to go to the hospital, don't be afraid. You can just go there once you call the family doctor first, of course. So I understand that this is a scary thing to think about if you have to go to the hospital. So there are two scenarios. Sometimes you have to go to the hospital if you are not infected with the coronavirus, and then the people in the hospital make sure that they separate the infected people from the not infected people, and also the doctors and the nurses, they wear protective material like masks and glasses to protect themselves from the virus, but also protect other people from spreading it, or from spreading it to other people. So if you don't have coronavirus, there are measures being taken so that the chances are lower that you will get infected yourself. if you have the coronavirus and you have severe symptoms, which is why you have to go to the hospital, the doctors can give you medical support. They don't have a treatment yet, but they can give your body support in fighting the virus. That sometimes can mean that you need oxygen, so you get a little tube in your nose which you can breathe through. And sometimes if you have pain, then like at home, you can get pain medication there. Most people do not need it, so most people who get the coronavirus can stay at home and have mild symptoms. Some people have to go to the hospital, and then for the majority of the people, it is enough to get oxygen, for example, and pain medication. But sometimes you have to have more medical help because your body cannot fight it on their own, and then you can go to the intensive care. There's only a small amount of people that have to go there. It's not most people can fight it themselves. So everything they do in the hospital is to help you and to make you better. Therefore, it is not a dangerous place. But what is dangerous is if you don't go to the hospital, if you actually need the medical help, and that is dangerous for yourself because the sooner you get treatment, the better it is. But it's also dangerous for other people because you can still infect other people if you stay outside of the hospital seeing people.
Yeah, that's very important that you underline that. Yeah. Well, in the migrant community, well, you have families who live together, but also you have friends who live together and who share the rent. So, what to do if my roommate, for example, has coronavirus? What should I do?
Mm-hmm. Yeah, so that has to do with, if you don't have any symptoms yourself, with the incubation time of the virus. So in the case that your roommate has coronavirus and you were in close contact with them, so you didn't keep 1.5 meters apart, you need to stay at home for 14 days because it is possible that you have the virus, but we don't know yet because you don't show symptoms yet, which is why, just to be sure, you have to stay at home as well for 14 days. If then you also, and I need to add to this, by the way, that you need, from that point, you need to stay away from your roommate. So keep the 1.5 meters distance, because otherwise the 14 days is not enough. And also make sure to apply the other rules, like cough and sneeze in your elbow. Also disinfect some of these surfaces in your house that are frequently touched, for example the toilet or the door handles. So stick to those rules as well to prevent, if you don't have the coronavirus yet, to get it from your roommate. And then if you get symptoms yourself as well, then that probably means that you also have the coronavirus. And then the other rules apply that I just told you about, that you have to stay at home until you are symptom-free for 24 hours, regardless of those 14 days time that you have to stay at home.
Yeah, okay. And also during those 14 days you stay at home, you still wash your hands all the time?
Yes.
Even when you're not leaving your house, or only to do your small shopping? Mm-hmm. Or is it not allowed to do the shopping during those 14 days?
If you don't have any symptoms, nothing at all, then you can go out just to do the groceries, and otherwise you have to stay at home as well. But of course, that's very important to keep disinfecting your hands every time you touch something or you came in contact with the person.
Yeah. Okay, thank you. Let's see, because yes, actually many people are interested if there is any therapeutic treatment for the coronavirus yet. Mm-hmm. Is there a vaccine? Is there a vaccination developed which really can fight the virus?
Yeah, that is a frequently asked question, and that is not the case. So there are two types that people are waiting for: a therapeutic treatment, which means that if you have the coronavirus, you can get medication to get rid of the virus. That is not there yet. They're researching this, they're investigating this all over the world now, but they didn't find this yet. That usually takes a long time. And then the other thing is the vaccine, which can prevent you from getting the virus or getting sick from the virus, I have to say. And that is also not there yet. And developing a vaccine is usually a process that takes years. because they have to test it in different stages, first on animals, then on people finally. That takes a long time because they have to ensure that it's safe. Now they're trying to speed up the process because a lot of people are working on this right now, and a lot of money is being put into it. But still, that can take, for example, a year before this is ready. So until that time, we have to stay to the distance taking and the cuffing and seizing the elbow, washing your hands. All those rules we have to apply them until there is a vaccine and we are all vaccinated.
Okay. Well, next to the professional medication which exists and which has been developed through testing, like you're describing yourself, we know also that in our communities there have been developed several traditional medications, and even people who have been sending this medication by post to Europe. What do you advise concerning this traditional African medication? Is it wise to use it, or does it really help? Is there any opinion about that?
Mm-hmm. Yeah, I also heard about these types of medication, not about all of them, so I cannot say whether some of them are dangerous or not. I know, for example, about the tea with lemon and ginger. Well, that is something that has vitamins in it, so that's good for you, but it will not prevent the coronavirus or prevent you from getting sick from the coronavirus. I heard also something about using traditional African herbs, for example. I don't know exactly what those, what that is and what that does, but I would advise you to not use that because we don't know what it actually does with you. And also, one thing that is sure is that it does not prevent you from getting sick, or also does not stop the coronavirus. That is very important to note. The only effective way to stop the virus from doing any more damage right now is to stick to the rules. So the distance taking and the washing your hands. Nothing that we know about helps against it more effectively than
Okay, so it's supposedly somebody is taking these traditional herbs from certain African regions. It's not the case that at the moment that he or she takes it, thinks, well, now I'm protected, I can go at the street, I can go into crowded places, I don't have to do the 1.5 meter distance. That is not the case.
No, that's not the case. In fact, that's actually really dangerous because it does not stop the virus and you can still spread it then. Yeah.
Okay. Well, thank you very much. Actually, next to the coronavirus, you can get sick for other reasons. Is it possible to go to the doctor again, or to phone the doctor? And then I'm talking about the family doctor, because in Holland, whatever you have, you need to go to the huisarts, to the family doctor first. And if he or she cannot solve the problem, you get a referral to the hospital. Only in cases of life-threatening situations. For example, if you get sick in the evening and you are worried, then you should call the spoedeisende hulp. Or if it's really death-threatening, you should call 112. But in general, Robin, is the doctor accessible again?
Yeah, they are. Sometimes it depends on with what kind of family doctor, with what practice you are in contact with. Since 2 weeks, I think so the doctors are seeing more patients in practice. Before that time, they usually saw people through video connection, for example, or to calling. Now they're trying to upscale this. Also in the hospitals, the standard care is being upscaled, so more patients are being seen in practice or in the hospital. So that is possible, but it depends on the practice that you are aligned with, and you always need to call before you go there. You shouldn't go there spontaneously, always call to make an appointment, and then the doctor will estimate whether it's necessary for you to come to the practice, or that you can also talk about it over the phone.
Yes, okay. Well, thank you so much for all your answers and clarifications on the issues. And I hope, viewers, that many things are clarified for you. Do you want to add or to give an extra advice to the viewers?
Of course, yeah. Well, most of the things, or all the things, I already told you, but to summarize this, I really want to say that it's very important to stick to those rules and to inform yourself based on the sources provided by the government, but also globally provided by the WHO. Really inform yourself by with those sources and that information, and don't listen too much to the myths that spread everywhere, also because of the coronavirus. It's really important to stick to those rules and also stay in contact with your family and friends at a distance, of course, or online, and really take care of each other and take care of yourself and stay healthy. That would be my advice.
Thank you so much, Dr. Jason.
Thank you.
Yes. Okay, well, it was wonderful to have Dr. Jason here. He gave us a lot of clarifications on issues which are discussed in the migrant communities. In the beginning of the interview, I gave you some information about two national programs. One program in which we focus on undocumented migrants, and one program in which we focus on asylum seekers and refugees with Dutch papers. To start with the undocumented migrants, if you are a lot worried about your health situation, or if you have complaints regarding being depressed, or you stress a lot, you can't sleep because of your worries, then we invite you to contact Doctors of the World. The undocumented migrants can contact us in various ways. For general questions, healthcare questions, you can call our help desk. Our phone number is 020 7653 801. I repeat, 020 7653 801. It's an answering machine, so please leave your name, your phone number and your questions behind on the answering machine, and you will be called back within a couple of working days. If you prefer to see a doctor live, you can visit our medical van. It's called the Zorgbus. The Zorgbus is visiting several locations in Amsterdam and Den Haag at specific locations and specific times. On our web page called Need Help, you can find these locations and the hours when the bus will be there. You can visit this bus without any cost, so it's free of charge. The consultations are free of charge. Also, it's possible to have a discussion with a psychologist by phone or with a specialist concerning family planning, pregnancy and so on, women-related issues. These specific questions regarding psychological issues or women issues, you can ask for a specific consult by contacting Doctors of the World through email addresses. These email addresses you can find on a web page, of which I will give you the address later in this talk. Then, when your question is more urgent and you don't have a family doctor, it's very important to know that you can ask your question to the huisartsenpost. Yeah, the huisartsenpost is a specific information hour after 5 o'clock, so after the family doctors are closed. You can call in case of medical problems which are quite urgent in the evening with the huisartsenpost. Yeah? The huisartsenpost, the phone numbers you can find on internet. You can Google them. Yes, it's called huisartsenpost. Another possibility is to visit in the evening between 7 and 9 the Kruispost Amsterdam. It's written Kruispost, Kruispost Amsterdam. And you can visit it on the Ouderzijds Achterburgwal, number 100. Please look it up at the internet. Also, this is free of charge. Now we go to the asylum seekers and to the refugees with papers. Normally, they visit the Zorgcafé. This is a location in a community house, which is every day open for social, psychological or medical questions. But they are closed now because of the corona crisis. When you're living in Amsterdam, you can call 06102 14634. I repeat, 06102 14634. You can talk there to an interpreter in Arabic, Tigrinya and Farsi. He or she will interpret the talk which you will have with the doctor. When you're living in Nijmegen, then you can call the number 0651257990. I repeat, 0651257990. This phone number you can reach. Also, you can call also for your worries and medical questions, or if you're feeling down or depressed, or if you're feeling stressed. This is also accessible in Arabic, Farsi, and Tigrinya. Well, viewers, I want to thank you very much for taking the time to watch this program. I hope you're clarified on a lot of issues. Least but not last, take good care of yourself. Keep distance from each other 1.5 meters. Cough in your elbow. Wash your hands regularly. And then, really, least but not last, I will give you the webpage of all the information I just shared with you. You will also see it on the screen. It's https://doktersvandewereld.org/contact/need help during corona crisis, and between the words need help during corona crisis you need to put a connection line. Please visit this page and you will see that we are still accessible for all your medical related questions. Okay, thank you so much for watching and take care. Bye-bye.
Viewers, I hope you've been well informed, and most of our questions also has been clarified by Doctors of the World. If you are undocumented, you still have rights to medical care. Get in touch with Doctors of the World. Please call them God, they are always there for us. Thank you very much for watching. I'm Veronica van der Kamp, and see you next time.